Hey, I'm going to take you through today some standing hip cars and some hip cars with a knee hinge as well, okay? So I'm going to show you both standing face on and also to the side. I'm going to show you a few key points that I can tend to do, and it's likely that you'll probably do them as well, okay? So starting off with our hip cars. So cars are our controlled articular rotations. I do the whole body. There is one of the videos with the whole body on as well, but this is just a focus on these hip area, okay? So starting off, we're going to take it up into hip flexion, okay? You tend to hold on to something if you can. Try not to grip, okay? You've got a little bit of tension in that body, packing that core. From there, we abduct the leg, okay? So it's key that we try and keep it at that height. Now, we want to not have any compensations. So compensations may be that you might lean, it might be that you might drop, or it might be that you might twist, okay? So we're coming up and we're rotating, so it's called an abduction, taking it away from the body. We want to try and keep it at 90 degrees and not let that foot and knee twist out as well at the same time. So keep it all in 90 degrees at the knee as well, okay? This is our hip focus. From there, we rotate that knee, that hip, okay? So we're rotating that hip, so we're coming up, okay? This might mean, as you can see, I've had to drop my knee. If I was to try and keep my knee high, it's likely that I would twist and I would compensate up here. So for me to keep those nice and neutral, I rotate, and it means that my knee has to go that little bit lower. From there, we abduct it back into the body. We then take it into a hip extension. Now our hip extension, I'll show you from side on in a minute, okay? But we don't want to arch that back. Our ribs are staying connected to our pelvis and we're not flaring up. So try and keep those ribs connected. We abduct out, so taking it out. We then rotate again round. We abduct it back into the body, low and on round. Round, down. So I'll show you again from this way. Hip flexion, abduction. Rotation, internal rotation at that hip, and then you're abducting it back into the body. Hip extension, abduction, external rotation at that hip, coming back into hip flexion, low and on down. So I'm going to show you from side on. Okay, so you want to try and keep those ribs not flaring and arching that back. So keeping the ribs soft, contracting, connecting all the way into that pelvis. So we're going to try and create a bit of tension. Take a deep breath in, push that diaphragm away. You can even create a fist as well. It creates tension throughout the whole of the body. We're coming into our hip flexion. We're then coming into our abduction, sorry. From here, you can see that if I was to keep twisting, it would compensate again. So I only go as far as what I can without anything else coming to play. We then go into internal rotation at that hip. Again, I've lowered my leg down, I've not kept that knee at that height because I'd compensate. From there, I abduct it back into the body. Now this is where it's key. So we then go into hip extension. Now a lot of people can kick the leg right the way back, but you can see, as I have done, gone into a nice arch, ribs have flared, okay? So you want to stay nice and neutral. So it could just be just small hip extension. And it's that tiny movement there. We're squeezing our glute and we're squeezing our hamstring as well. I go any further, you can see my back's gone into an arch, okay? So it's good to use mirrors, see what you're doing. So hip extension. We then abduct it on out, rotate round to the side, and coming back into the body, lowering on down. Okay, so same again from the side, coming on up into hip flexion, abduction, internal rotation, adduction back into the body. Hip extension, keep control of that back, abduction, external rotation, abducting it back into the body, lowering on down. Before you progress onto the hip hinges, it's crucial that you get that right. Do it over and over again if you need to, okay? And we're not trying to get too much movement. We're really thinking about that hip joint and working that whole area. The more you do, easier it'll get, and you'll start to move that hip in both end ranges rather than just that middle range. Do the same on your opposite leg. I'm going to show you all on one side. I'll even it all up after. But for instance of the video, we're now going to show you the hip hinges. Hip hinges? Knee hinges, okay, with our hip rotation. So we're coming into hip flexion. You want to try and get this knee up as high as you can. So if I was to be side on, this is my active range. Imagine if I was to pull it up, I could actually get my knee really high up in here. And you've got to try and hold that hip and knee up at that height. From there, again, try not to round, just spotted myself, sit nice and tall. We'll then take it into an extension. Your knee might drop a little bit, that's okay. Working my quads really hard here, you might be able to see me shaking. Coming back in and try and get that knee right the way back up to that height that you just had it. We're working, strengthening those hip flexors. Again, extending on out, coming back in, get that knee nice and high, and then lowering on down, okay? Trust me, it is hard work. You can tell by me being out of breath, I sound unfit, okay? But it's just coming up. This would be your active range. Really try, get it up into that passive range and holding that passive range. You could just hold there for 20 seconds. 10 seconds would be enough. Really working that hip flexor in there. Extend, coming back in. Extend. You could hold that extension for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Bringing it back in. Lowering on down. You're also going to feel your standing leg, okay? It's going to work both sides, so make sure you shake it off. Just giving you a few variations of what you can do. Same thing applies when we come into our, gosh, right wonky donkey then. Coming up, we're going to rotate, okay, into that abduction. From there again, you can go into that knee extension, into that hinges, working into that adduction a little bit more, and that quad still working in that hip flexor as well to stay up at that height, okay? Then you're coming back up nice and high. From there, we can go into our rotation, internal rotation, and again, we can kick out to the side and then back up. Now make sure that you're not rotating it back, okay? So you're keeping it so your thigh is facing forward and you're going extending, then you're using your hamstring to come back in. So extending on out, hamstring curling that leg back in. Work that hamstring, work that glute, coming on out, back in. You can hold in there, coming on out and back in. And you'll notice when I'm coming back in, I'm coming further than that 90 degree to work that hamstring. Lowering on down. I'm just going to show you that from side on, okay? Should probably change legs, so the other one's aching now a little bit. But we'll do that after. So you're coming up and abducted. So this is what it's like from that abduction. I'm coming straight from that side. Again, if I was to rotate round, my pelvis comes into play. So make sure that I'm sleeping that hip nice and neutral and pelvis facing forward. Again, you can hold on both at the same time. We're then going to rotate. Okay, from there, I'm extending out, and you can see that I'm curling that leg in more to get that hamstring to work. Taking it on out. Make sure this is controlled, guys. Slower, the harder, trust me. Taking it out and back in. And then we're lowering on down. Same applies, I'm going to show you the hip extension as well. So again, remember, we don't take it that far out, okay? We're not bringing it right the way up. So I'm taking it out, squeezing in there, extending at the knee, and then again, I'm curling back in. I can really feel that hamstring having to work, extending back in. Now making sure that my knee actually doesn't come out of my hip doesn't come out of hip extension. So you might be aware, looking at that mirror, where is that knee, the hip extension end? Just so I don't bring it back too much, okay? And again, just these curls in here. My hamstrings are lovely and weak, okay, from my ACLs, taking hamstring grafts, and it's been apparent these past few months of how weak they really are. Working on there, and again, you can have some isometric holds for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relaxing on down. Okay, so make sure you alternate legs. I'm going to have to do the same again on the other side. But just that's a little bit of a capture for you of what you can do in that hip hinge. Hip hinge, hip cars, and also adding that knee hinge on, okay? You're probably getting used to me saying the wrong words and saying the wrong thing to the wrong move. Oh, I can't even say. Wrong moves to the different words. Okay, so have a go and yeah, let me know your thoughts. Clients of mine, just let me know if you're unsure of how many reps, how many isometric holds to do. Just message me and I can easily send that out to you. Anyone else that's unsure, please feel free to drop me a message.